Cancer Research. What's exciting the experts? Part 2. In the second piece of our What's Astonishing the Specialists series, Medical News Today talked with another gathering of malignant growth specialists. We asked them what late advances have given them the most expectation. Malignancy research proceeds at a rankling pace. Dan Kitwood, Getty Images. Malignant growth is anything but a solitary infection, however an assortment of illnesses. It is perplexing and doesn't promptly surrender its insider facts. Notwithstanding the difficulties disease stances, researchers and clinicians keep on sharpening the manner by which they analyze and treat it. Present-day medication implies that analysis rates for some malignancies are up, as are endurance rates. Notwithstanding, with an expected 19.3 million new instances of disease worldwide in 2020, there is still a lot of work to be finished. MNT as of late reached various clinical specialists and analysts and got some information about the parts of malignant growth research that they find generally invigorating. Their answers are captivating and exhibit the extraordinary assortment of approaches that researchers are utilizing to comprehend and battle disease. Microscopic organisms and attraction. We will begin the present excursion into state-of-the-art oncology with an amazing visitor: attractively responsive microorganisms. Because of the trouble of focusing on fundamentally conveyed therapeutics for disease, interest has filled in abusing organic specialists to improve tumor gathering, clarified Professor Simone Schirle-Fink, PhD, from ETH Zurich in Switzerland. As such, getting disease medications to the opportune spot isn't just about as direct as one would trust. Professor Schirle-Fink is among the scientists who are presently enrolling the assistance of particular microscopic organisms. She disclosed to MNT how researchers have known for a century that specific microbes can colonize tumors and trigger relapse. She clarified that today, because of current hereditary designing procedures, constricted microscopic organisms are accessible that can have a restorative impact precisely where this is vital. These helpful impacts incorporate emission of poisons, contest for supplements, and tweak of invulnerable reactions. Notwithstanding, regardless of the guarantee of bacterial malignancy treatment, there are still difficulties to meet. Conveying the dosages to the ideal spot and getting them into the tumor stay premier among difficulties hampering clinical interpretation. Just about 1% of a fundamentally infused portion arrives at the tumor, clarified Professor Schirle-Fink. To address these difficulties, her group at ETH Zurich is utilizing attractively responsive microorganisms. These purported magnetotactic microorganisms normally situate themselves, like compass needles, to Earth's attractive field. Albeit this capacity advanced for root, researchers are quick to see if attractive directing or pulling could permit them to repurpose it for malignant growth conveyance. In a new report, Professor Schirle-Fink and her partners utilized turning attractive fields to abrogate the microscopic organism's normal drive. As the creators of the examination clarify, they utilized multitudes of magnetotactic microscopic organisms to make a directable, living ferrofluid. These magnetotactic microbes have an appeal for iron, so when they arrive at the tumor, as Professor Schirle-Fink told MNT, they can metabolically impact disease cells through starvation from this essential supplement. We have displayed in vitro models that an expanding number of microscopic organisms actuate an upregulation of iron rummaging receptors and passing in malignant growth cells. By joining designing standards and engineered science, we plan to give another system to bacterial disease treatment that tends to a significant leftover obstacle by working on the proficiency of bacterial conveyance utilizing protected and adaptable attractive upgrades to these promising living restorative stages. Professor Simone Schirle-Fink, PhD. Customized medication. Customized medication is changing the scene of medication and how medical care suppliers can offer and plan customized care for every one of their patients, trusts Dr. Santosh Kesari, PhD, head of neuro-oncology at Providence St. John's Health Center in Santa Monica, CA. Dr. Kesari is likewise seat of the Department of Translational Neurosciences at St. John's Cancer Institute and Territorial Clinical Chief for the Research Clinical Institute of Providence, Southern California. Portraying customized medication, Dr. Kesari said, "It is a methodology for sickness avoidance and therapy that considers natural, hereditary, conduct, ecological, and social danger factors that are exceptional to each person." He proceeded, Customized medication is established in early recognition and counteraction. coordinating information from genomics and other trend-setting innovations, advanced well-being observing, and consolidating the most recent clinical developments for improving results. This is getting clear in oncology, where hereditary testing for tumor changes and inclinations is progressively being used and showing more worth in utilizing designated medicates all the more carefully and further developing results. Dr. Santosh Kesari, PhD. Some customized malignant growth approaches are as of now being used, like EGFR, HER2, and NTRK inhibitors and the very customized CAR T cells. As indicated by Dr. Kesari, the fate of personalization is splendid, and progress has just sped up in the previous 5 years. Chronotherapy, counting down disease. Proceeding with the personalization topic, Dr. Robert Dahlman from Warwick Medical School at Warwick University in the United Kingdom conversed with us about chronotherapy. Impelled by the 2017 Nobel Prize in Medicine or Physiology, going to 3 circadian scholars for uncovering the subatomic system of circadian organic clocks, malignant growth chronotherapy is acquiring basic energy to enter standard oncology, particularly with regards to customized medication. Dr. Dahlman clarified that many key physiological cycles in the cells of our body are adjusted in an everyday style by the circadian clock. These cell checks are upset in certain tumors, however not in others. Strangely, a useful check in the tumor predicts the endurance season of patients, which has been displayed for mine just as bosom tumors. In this manner, he clarified, if researchers could decide the check status in strong tumors, it would permit specialists to all the more effectively decide if a patient is at high or okay. It may likewise assist with directing treatment. There is extraordinary potential in streamlining treatment plans with existing medications by considering the collaboration with the circadian arrangement of the patient, proceeded with Dr. Dahlman. All the more as of late, the circadian clock system itself has been proposed as a novel therapy focus in glioblastoma. The creators of the glioblastoma study reasoned that pharmacologic focusing of circadian organizations explicitly upset malignancy, undeveloped cell development and self-restoration. Notwithstanding, regardless of whether this may be summed up to numerous strong tumors or much other ongoing infections still needs to be explained, said Dr. Dahlman. In outline, he told MNT, circadian timekeepers have for quite some time been perceived to tweak constant sickness on numerous levels. The expanded unthinking arrangement can possibly further develop finding and existing therapies of malignancy, just as foster another class of clock focusing on medicines. Kidney malignant growth blend treatment. Dr. Chung Han Lee is a clinical oncologist at Memorial Sloan Kettering Cancer Center in New York. He is likewise an individual from the Kidney Cancer Association's Medical Steering Committee. He talked us through ongoing advances in the therapy of kidney malignant growth. The turn of events and ensuing administrative endorsement of blend immunotherapy for patients with metastatic kidney malignant growth have prompted groundbreaking change in the existences of numerous patients and are the sign of what more prominent logical agreement has meant for disease care, Dr. Lee told MNT. Preceding 2005, therapy for metastatic kidney disease was exceptionally restricted, with most patients dying in under 1 year in spite of going through treatment. According to Dr. Lee, the advancement of antiangiogenic drugs that hinder the development of fresh blood vessels was among the principal forward leaps to work on the results for patients. In any case, even with antiangiogenic drugs, most patients eventually created protection from treatment, and 1.5 years was viewed as a drawn-out reaction. Next came immunotherapies. Before the advancement of antiangiogenic meds, it was realized that kidney malignant growth could be treated by initiating the invulnerable framework to more readily perceive the sickness. Nonetheless, the apparatuses to enact the resistant framework were frequently vague. Accordingly, reactions to these early immunotherapies were uncommon, and the results identified with treatment were troublesome as well as could be hazardous. With late advances in immunotherapy, we have shown that more designated immunotherapies that actuate explicit invulnerable designated spots are conceivable as well as can have considerably expanded action against illness. 2 arising therapy approaches have now gotten the new norm of care for kidney disease: double immunotherapies, for example, ipilimumab, nivolumab, or mixes of antiangiogenic designated treatments with immunotherapies, for example, axitinib, pembrolizumab. In patients treated with ipilimumab and nivolumab, more than half stay alive at 4 years, and with some combined anti-angiogenic and immunotherapy approaches, almost half of patients stay on their underlying treatment at 2 years. Regardless of these advances, Dr. Lee is a long way from careless, revealing to us that there stays impressive work to be finished. Opening square bracket ellipsis. Unfortunately, in 2021, for most patients, kidney disease stays lethal. In any event, for the individuals who have exceptional R.